ATG, Dr. Alalade here, and Ask the Gynecologist. And this morning is going to be a wonderful one. I am coming up live very early today because obviously it's going to be a wonderful one. And I want to catch up because I've been extremely offline basically since Monday, Tuesday, and Wednesday. And it's a wonderful day to be alive, and I want to catch up with everyone. And this morning I have an important topic to discuss. Hello, good morning, Lily Ibezim Nwachukwu. Thank you so much for joining here today. Since I have a bit of time before I get to work, I'm quickly catching up with you this morning to take some questions and have some time to answer questions that you might have. I'm not sure if my audio is good, so if you can hear my audio well, Lily Nwachukwu, let me know. That's Lily Ibezim Nwachukwu. If you can hear my audio well, let me know. If my audio is not good, I would love to know so I can adjust my settings here. I want to say a wonderful day. I'm grateful to be alive, and I'm definitely sure that you are grateful as well to be here and to be alive. You see, each day we have the opportunity to be alive. We should and we must be grateful to God, because God is the giver of life, and He is the giver of all things. Thank you, Chiamaka Ibe. Thank you, Shobaloju Yewande Adebisi. Thank you guys for joining here today. You know, ATG, Umidiji Olajumoke, good morning. ATG is a peculiar group online. It's a group where every woman in Nigeria should be on. It's a group where you come every day and you learn a lot. Thank you, Tochukwu Victoria, Otulewa Adeshola, and Omek and Etam Obuli, Anajuba Chinazom Elma, Omeka Siabunwa Etam Obuli. So see, and everyone that is watching, thank you. Good morning to everyone. I've been Bola Kehinde, Wojo Ade, Cecil and James, Oluwabukola Ayuba. Oluwabukola Ayuba, I think I got a message from you sometime this week or last week, if I remember. Your name sounds familiar. I think I got a message from you. I can't remember. But if it's you, thank you so much for messaging me. Luchi Moon, Mary Yetunde Mayaki Abo, Patricia Mokupo, Comfort Francis Olubumi, and Cecil and James, my wonderful sister Cecil and James, thank you so much. Victoria Okezwe, Delanyo, Cynthia, Jonathan, Chizoba, Juliet, Michael, Ogundele Mary, Emu Obo Oga, Cecile, thank you. So it is a peculiar group in the sense that it's a group you come in every day and there's something you pick up. Even if you don't pick up something to learn, you pick up something that will change your life. What we do in ATG is to teach you, by the grace of God, how to make the best of your life. Thank you, Rachel Bererang. Thank you. Much love from here to you too. In ATG, we teach you how to make your body a better body, and also how to improve your mindset, because we know that the human body comprises of the body, which is the physical, and the non-physical part of our body, which is the mind, is also very crucial. If the mind is sick, the body will be sick. If the body is sick, eventually the mind will be sick. So we look after both. We talk to you every day about positivity, how to change your mindset, how to change your life set, and how to turn your life around if you want to. You see, in life, as a man thinketh, as a woman thinketh, so she is. The way you think is usually the way you turn out to be. You see, our software, which is our mind, is the most critical part of our lives, and always has an effect on how we live. Okay, so a healthy body is always health conscious. To be healthy, you have to be health conscious, and there's no way you be health conscious as a woman and you will not in any way come across as gynecologist online. So ATG, by the grace of God, is God's own choosing to change lives today for our people. What we've done in ATG, we've used ATG as a medium to teach, to correct some things. Sometimes you come to ATG, you hear some things, it annoys you that what are these people saying? The things we say here are medically proven. It's not just what I know, what my grandfather told me. Okay, some of them I didn't make them, but it's what it's fact, medical fact. So we teach what it's fact, theoretically backed fact, which are proven. Okay, so when we come to ATG to teach, we're not just teaching and talking. We talk things and we discuss things that are proven, things that are sure, things that work. Okay. Good morning, Rita Ibinabo Phillips. Good morning, Eneabu Amara Samuel. Miriam Ijoma, Evelyn Ezegbige. Thank you. Stephen Charity Chinedu, Adesoji Jumoke Oluwakemi, and Taye Jennifer Watunde Adeniyi, Abimbola Kubi Onalapo, Pam Josephine, excuse me, Faithfulness Adajo, Didi Bazi Zinzi Wambavoy, Samson Omoregbe Obasui, Ife Injemanze Omini, Anjo Alalade Adeleke, Mami Nadi, Cecil James, and Oversweet Vicky Zini, Umar Dahiru Abubakar, Zara Kumalo, Sarah Kumalo, Gift Goody, Tracy David Ter. And if you are a Muslim, you're fasting, I want to say God bless you. And by the grace of God, our prayers will be answered by God's grace. I believe and have faith in all religions, and I know that it's one way for us to contact God. Okay? I respect everybody, wherever you come from. You realize that people in ATG, they're from every part of the world, every part of Africa. People come from Southern African countries, South Africa, Zimbabwe, Kenya, Botswana, Tanzania, and so on and so forth. People are from Nigeria, Ghana, Sierra Leone, Cameroon here. We meet here to share our common dream, the dream to be healthy. ATG is a global group, and ATG is a group not owned by any particular country, neither is it owned by any particular tribe. I may come from one tribe, but my nationality is the UN. I'm a global citizen, and you too should be one. All human race will share one common good. So before we waste too much time, this morning I'll be talking about yeast infection and infection in the vagina and how this can affect pregnancy. Remember last week I made a post on the group and I talked about yeast infection. People have questions about yeast infection. And I can tell you, most women looking at me right as I'm talking now, at least 10 out of them, if you pick 10 out of every cohort of everybody watching me, 4 to 5 will have yeast infection this year, most especially if they are pregnant and if they're using antibiotics. And you wonder, what is yeast infection? Let me tell you something. Yeast infection itself, candida or thrush, whatever we call it, is the same thing. They live in the vagina. James, yes, James Uzuli, we will see each other once COVID is over. We'll arrange an appointment and we will talk about it. Okay, so first of all, let us listen. Then we'll take questions. At this morning, I think I'm here on time and I have a bit of time to cover, to stay here. I'm not in a hurry today. This is 7:50, so we have a bit of time to catch up. So yeast infection normally lives in the vagina. Yeast infection, the environment is the vagina. They love the vagina. Okay, so there's yeast and they live in the vagina. But when yeast becomes plenty, they start to grow a lot, okay, and the population past the normal population, okay, in the vagina, they become yeast infection, okay. When yeast colonization becomes rampant in the vagina, it becomes yeast infection. And there are some particular things that a woman can do that will make yeast in the vagina that is normally quiet become very, very plenty, or very, very plenty that become an infection. I'll put it in the African way like that. So what will make yeast that normally is quiet in the vagina become plenty? Like I said again at the beginning, yeast itself, it lives in the vagina. It's there all the time. It's quiet, not noticeable. But sometimes it becomes plenty. It's very common for yeast to be plenty during pregnancy. During pregnancy, the environment of vagina will change and it will be so conducive for yeast. And because it's conducive for yeast, they start to multiply and become plenty. That is why in pregnancy, see a lot of people, they come down with yeast. The vagina is so painful and so pepperish because of yeast infection. They don't want to have sex with their husband. The husband touches them, they are angry. Pregnant woman, everything is angry in their body because pregnancy is stressful. So a pregnant woman must be looked after with care. If you're a man, or your wife is pregnant, look after her with care. Care for her like an egg. Because pregnancy is stressful on the body. So yeast infection has extra stress in pregnancy. More so if you're pregnant or not, if you're using antibiotics. Some people, whenever you use antibiotics, maybe for chest infection, for tummy infection, antibiotics or for typhoid, antibiotics for so many things, they also have yeast infection because antibiotics when you take antibiotics, it changes the nature and the environment in the vagina and makes the yeast more profuse. That is why if you're prone to having yeast, whenever we give you antibiotics for infection, always tell your doctor, I'm prone to yeast. So as they are giving you treatment for yeast, they give you antibiotics as well to add, to take for that duration while you are taking the medication, antibiotics. It's important. Don't forget that. As people get older, 60, 40, 50, 50, 60, 70, the environment in vagina becomes not too friendly. Okay, yeast can become bad too in elderly too. Okay, the same thing can become bad too if a child is very young, baby, 4 or 5 years old, and they're taking antibiotics. Yeast can happen to them too. So you can see that if yeast can happen to the very, very old and very, very young, yeast infection is not a sexually transmitted infection. Okay, yeast infection is not a sexually transmitted infection. However, during yeast infection treatment, okay, I would suggest that you should abstain from sex if sex is very uncomfortable during that period. It will allow every area there to heal. Yeast infection can make the skin of vagina very, very fragile and very, very peppery and painful. Obviously, if you're having a sex during the time when you have yeast infection and that area is very, very sore, sex will become more painful. So naturally and by common sense, I would say avoid sex whenever you're having treatment for yeast infection. It's not because you transfer the infection to your man, no, but because it's much easier for the vagina to heal while you're taking treatment for the yeast infection that is there. Yeast infection can make sex very, very uncomfortable. Okay, so while you are having treatment for yeast infection, you should avoid sex, not because you can transfer the yeast to your husband, no, but because you want to allow that area to heal. Okay, while you are taking yeast infection treatment, there's no need for the husband to be treated. Men don't get yeast infection in the penis. Okay, it's very unusual, but if it will give you peace of mind to treat your husband, to treat him by all means, but it's not necessary again to treat men for yeast infection in penis because they don't even have it anyway, especially if they've been circumcised. There are many types of yeast infection, many types. They come with different names. Like me, I have my name now, Babajide Alalade. My brothers too, they have their names too. So and so. Alalade, this and this, Alalade. Same thing, yeast infection, they have the same surname, but they are different too. Some can be planted in the mouth, some planted in the throat, some in the vagina. In most cases, if you are very sick, very, very sick, just because you are sick alone, the environment of your body will change and it can make yeast infection even more profuse and make you more prone to yeast infection. Okay, for example, if you have chest infection, you have a kidney problem, diabetes, it can make yeast infection very, very bad in your body. That is why if you're taking all those medication for chronic diseases, you must ensure that you don't miss your treatment, because if those treatment, diabetes, if they become uncontrolled, it can make yeast infection very, very bad in your body. That is why if you're taking any treatment for such infections or any disease, ensure you are there and you stick religiously to such treatment. It's important. It's not a joke. Yeast infection does not block the tubes. I've seen people, they've gone for swab test and they come back, doctor, they told me I have yeast infection. It's causing my miscarriage. Yeast infection does not cause miscarriage. In fact, yeast infection cannot enter into the womb, so it does not cause miscarriage. Okay, it does not block your tubes. It does not make your baby not to grow. Okay, yeast infection does not cause miscarriage. It does not cause bleeding in early pregnancy. If you're miscarrying, there are other many reasons why you can miscarry. It's not yeast infection. God forbid. If you miscarry, there are many reasons why you can miscarry. Yeast infection is not one of them. Am I making sense? I know people are already asking questions. Just chill. Don't forte. Just calm down. We'll answer questions this morning. But I want you to first of all understand. When you understand these things, it's easier to carry along. Staphylococcus does not cause infertility. Staphylococcus is not a sexually transmitted disease. Staphylococcus aureus is not a sexually acquired infection. Yeast infection does not cause PID. It does not block tube. In very, very rare circumstance, Staphylococcus can cause PID if that person is very, very, very sick. But it's very rare for Staphylococcus to cause PID. but in very exceptional circumstances, it can cause yes PID, but it's very, very rare. That is why if I find a woman have staph aureus in their vaginal swabs, I just give them treatment just to prevent. But staph aureus is not a notorious cause of miscarriage. It doesn't cause miscarriage. It's very rare for it to cause PID, okay? And yeast infection does not cause PID. But by all means, if you have yeast infection, get it treated. When you are treating yeast infection, you don't need to worry about your husband. Treat yourself, okay? During yeast infection treatment, you don't need to avoid sex. You can avoid sex because the vaginal area there is very, very uncomfortable. So while you are treating, allow the area to heal. Not because you are afraid of transferring infection to your husband, but because you want the vagina to heal. Vagina can be very peppery and very, very sore with yeast infection, making you to avoid sex with your husband. So you want the area to heal. Merci beaucoup, welcome. So let's take some questions before I go to work. What is the cause of scanty flow blood during menstruation? Maybe your cervix is blocked, maybe you have fibroid or polyps. They can cause scanty flow. How do you prevent yeast infection? To prevent yeast infection, first of all, is hygiene. Hygiene. Don't douche. The vagina itself is self-cleansing. The vagina will cleanse itself. Okay? The vagina is cleansed and clean through sex, through your period. Vagina does not need you to put your hand in and start cleaning. You can wash the skin in your vagina outside, but don't put anything in your vagina. People that put all those rubbish in their vagina, all those jagojantis in the vagina, they are causing and they're increasing the risk of PID. And they are causing increased risk of damage to their tube. Don't put anything, whether anything, whatever they call it in any language, don't put anything in the vagina. The only thing that goes in your vagina is one, your husband's penis. Two, if you have sex toy, if it's your business, that's your problem. Number three, tampon. Any other thing than that, don't put in your vagina. Don't put anything in your vagina. Yeast infection, to treat it, we give you pessary, canesten pessary, canesten cream, or diflucan, fluconazole. You can take fluconazole to treat yeast infection if you're not pregnant. But if you're pregnant, you can use diflucan, you can't use fluconazole. If you're pregnant, you want to treat yeast infection, we give you canesten. Canesten is more reliable to treat yeast infection. And if in your situation you suffer from yeast infection all the time during pregnancy, we can give you treatment every week to prevent yeast infection all through pregnancy. If you're not pregnant and you suffer from recurrent yeast infection, it's always very good to take swabs in your vagina and to check for any other infection that could be there. Presence of other infection can make you prone to yeast infection. And we also go through the things you use to clean your vagina. The things you use, what pants you wear, what kind of tight clothing you wear. People that wear all those leather clothes, tight jeans that hair cannot blow into their vagina, they are risking yeast infection because it makes the vagina environment not to be able to breathe. If you wear tight clothing, tight leather trouser, because you want to look fine, it's okay to look fine. A lady is designed to look fine. If you want, it's okay, but be balanced in the way you dress. Wearing tight-fitting clothing increases the risk of you prone to yeast infection. It's okay to wear tight clothes. I'm not saying you should not wear tight clothes. Don't get me wrong, bro. What I'm saying is, don't wear things that will make vagina too tight that you cannot breathe, air can't flow in it, and that will make you prone to yeast infection. Somebody is saying a girl of 11 years, she has yeast infection. How can she be treated? She can use diflucan if she's not pregnant. Again, she's not pregnant, 11 years, she can use diflucan to treat yeast infection. Somebody is asking, how does she go about scanty flow during menstruation? First of all, get ultrasound scan done and do your hormone profile, including your FSH, LH, thyroid hormone, and prolactin. Can low blood level prevent delay pregnancy? No. Low blood level cannot delay pregnancy. But if you have low blood level, it can make you faint and it can kill. So to be able to have baby, be alive. To be alive, ensure your blood level is okay. If they're giving you iron to take, take it. If they tell you need blood transfusion, take it. If you don't like blood transfusion, talk to your doctor for the best option. Low blood level, Omawumi Naomi Afolabi does not delay pregnancy, but they can kill. You got to be alive to be able to get pregnant. What causes hotness of stomach? Anything. Infection, ovulation, appendix infection, appendix swelling, bladder infection, bowel infection, typhoid infection. They can all cause hotness in your stomach. So we need to consider every option. We need to do ultrasound scan for your tummy to check your ovaries, to check your womb. We need to do tests for thyroid and malaria. We need to do ultrasound scan to check your appendix to know what is causing hotness in your stomach. And if possible, too, we do your hormone profile. If you want to get that done, Debbie Thompson, Uyene, go to ATG Laboratories today and get all your blood work done, and I can go through and give you your result. Like I tell all the time, if you do any test at the ATG Laboratories, I am obliged to review your result and to give you expert opinion. Somebody, if Naya is just joined, if Naya is there, thank you. You're just joining for the first time. You're welcome to ATG, the best group on Facebook, where we talk about gynecological health and how to improve your health as a lady. So welcome to the group. God bless you. Somebody is saying, where does our center is in Lagos? Our center is ATG Laboratories. Is on 67 Agege Abeokuta Expressway, Alimosho, and you see there boldly written on the expressway, Ask the Gynaecologist. It's written in blue, and you can't miss it. One of our team members, our moderators, will put the address now shortly on the group. One of our members, board members, our moderators, will put the address of the laboratory on the screen now, and you can call and go to laboratories. Amaka Ken, welcome. Modupe Abigail Jimo, good morning. Christobel Obiano, Ju Blessing, Inga Marijo. Blessings asking, with good hygiene, can yeast infection go by itself? Yes, it's possible. But if it's not going, then get treatment. Spell out the name of the infection. Someone is asking the medication for the yeast infection if you're not pregnant. Diflucan. Diflucan is, get your pen. Now, get your pen. Diflucan. D for dog, I for India, F for foxtrot, L for Lima, U for umbrella, C for Charlie, A for Alpha, N for Nancy. That's Diflucan. It's for treating yeast infection if you're not pregnant. If you want to get the yeast infection treatment guideline I've written in ATG, you can pay for the yeast infection guideline PDF. I already did the PDF where you can get and keep forever, and you can always use it to treat yourself for yeast infection. It's available on ATG PDF archive, 750 naira. You can pay for that, get it, and you can go through it and treat yourself today. Can low-level FSH delay pregnancy? Very unlikely. I need you to follow Deoluwayemi. Low FSH does not delay pregnancies. If you have FSH more than 30 on 2 occasions, 6 weeks apart, they can affect you not getting pregnant. Faith Favor Okechukwu, welcome. Vivian Justice, we're not in Abuja, we're only in Lagos and online. Rachel Eberi, does metformin cause bleeding? Metformin does not cause bleeding. Can little drop of blood as period day? Thank you, Blessing Adenike. Thank you, Nike, for putting the address. If you're trying to get on ATG and you want to go to our address, Blessing Adenike just put our address now. We're not in Abuja, we are in Lagos. Thank you, Blessing Layade, for putting up the address for the laboratories. Unwachuku, rejoice, rejoice. Which medicine can a pregnant woman that is having sore throat take to stop the pain? You can use paracetamol, you can use ibuprofen if you're not asthmatic. If you don't have ulcer too. Can mycotin be used for yeast? Yes, you can use mycotin for yeast infections. Eboluwatoyin Johnson Abiodun, you can use mycotin for yeast infection. Most women, 4 out of 10, will suffer from yeast infection this year. Don't be one of them. Watch this video over and over again to understand what it is or what I'm saying. Okay? Little drops of blood. If you see bleeding on the first day of period, that is your first day. Any day you see blood happen, bam, that starts as your first day, and you start counting day 1 onwards. Okay? Good morning, Amaka Ken. God bless you, my sister. Nana Sulat Kende. Good morning, sir. My period is coming 7 days. Is that okay? It's okay. If it's more than 7 days, then it's not okay. Is artemether lufantrine good for malaria and pregnancy? Artemether is okay. Ikechukwu Okonkwo, what's your message? Let us see your message. Can hepatitis B patient have a healthy baby? Yes. As far as you get your immunization and you vaccinate your baby once the baby is born. What causes abdominal pain on ovulation? It is normal. The act of ovulation itself causes abdominal pain. In fact, we call it mid-cycle pain. It's known in science that on the day of ovulation, there'll be a dull pain on the left or on the right from where you're ovulating from. It's called Mittelschmerz pain. Mittelschmerz pain. Mid-cycle ovulatory pain is normal. Take paracetamol for it. If you're not also patient, if you don't have asthma, you can add ibuprofen as well. It is okay and it's safe to do that. Bankio Shadia, welcome from London. God bless you. Thank you, my sister. Lady White, I hope you got an answer. Lady White Sylvester, wonderful, beautiful lady. Thank you so much. Oluwakorede Ogundele, she's saying, can low progesterone cause infertility? Yes. Your progesterone ideally should be at least 18 or above to give us and give me guarantee that you're ovulating. If your progesterone is low, go and join ATG services and let me work with you to change your lifestyle, to change your story. The dose of Diflucan, once you get Diflucan, come and talk to me, okay? Get Diflucan and talk to me, okay? Diflucan, it comes in 150 milligrams. Get it and talk to me, okay? If you not get, or if you don't organize about that, you can get the ATG PDF treatment on yeast infection, and all the doses is there, okay? All right. Tinu Ogumbi, she's saying, why do I have cramps day before seeing my period? It's normal. Some people do have cramps before they see their period, and it can be normal for some people. Some people, they have endometriosis, and they have cramps that will be so bad, and as soon as the period comes, the cramps will go down. It's endometriosis. It can be endometriosis, okay? Okpado Kumbesola, the best treatment for uterine addition. If you have scar tissue in your womb, the best treatment is to do hysteroscopy and scar resection. We put the camera into your womb cavity, and we go and take out all the scar tissue. Nobody can use any hand to go and remove scar in your womb. Nobody can use medication to go and dissolve scar in your womb. We have to go there physically and resect the scar with an instrument, what we call hysteroscopy, to resect the scars in your womb. Ezomo Tina, welcome. Luchi Moon, my period came and lasted for 14 days. Is that a cause of uterine? Yes, if your period is lasting for 14 days, go and check for fibroid. Go and check for adenomyosis. Go and check your womb. If your womb should not bleed for 14 days, it's too much. Check for fibroid, go and do ultrasound scan, and also do swabs to check for infection in your womb. What causes constant menstrual pain every month that does not flow properly? It could be endometriosis. So go and get your hormone profile done and get ultrasound scan done to check your ovaries to know what is going on. The PDF for yeast infection is 750 naira. Nike will post the link. Nike, my secretary, will post the link for the yeast infection shortly. Moderate growth of staph aureus from Rachel Sampson. Nothing to worry about. But in most cases, we'll do the swab. We'll give you that, take this antibiotic for staph aureus. Take the antibiotics. But in most cases, staph aureus does not need treatment. But if you want to have peace of mind, take the antibiotics that you are given and let your peace be full. Okay? What causes movement in stomach? As if you are pregnant and you are not. Because it's your stomach. Your stomach will always move now. Food will always move in your stomach now. Why won't your stomach move? Stomach is designed to move and to digest food. So, but if you don't know what you're talking about, I'm not sure if you're right. Maybe you're talking about your womb or your intestine. Your intestine will always move too. Okay? So if you look at your tummy now, the only thing there is your what? Your stomach, your bladder, your womb and ovary, and your intestine. Your intestines will contain all this. Your bowels, your stomach, and extensions like the liver and the gallbladder. Okay, so where would the pain coming from? What is moving? Everything is moving in your body. Now, when you say your stomach is moving, what will not move in your stomach? Your intestine will move like earthworm. Your bladder will move to empty your bladder. Your womb will move during period to empty the blood. So your stomach is moving so what's not moving in your tummy? It has to move. So let's be focused. Let's see. If you are in this group, you realize that such things don't exist. What will make your stomach to move? Why would your stomach move? It has to move. It's designed to move. Okay? So Amaka Ken, your question, I don't get it though. Symptoms of yeast infection. Pain when you pass water. Very heavy, thick, white discharge from vagina. I'm not talking of discharge you see during sex. So during sex, some people, they see white fluid coming out. That's not yeast though. During sex, some people, they'll see white discharge. It's cream. It's not because they are aroused. They are having orgasm. That's not yeast infection. Yeast infection, they just have this white thick discharge like yogurt in the vagina. That's yeast infection. And it makes the skin of vagina very, very sore and painful. Adana love, thank you. Abisoya Ateji. Can low T4? Yes, low T4 can cause infertility. Yes. And if you get pregnant, it can increase the risk of miscarriage too. Good morning, my sister from Togo. Welcome. Devlin Glory Chapel, Togo. Welcome from Togo, my sister. God bless you. What is the best procedure for follicular tracking? Ultrasound scan. Stella Erefushebefe. The best procedure for follicular tracking is ultrasound scan. You use scan. What causes blooding after lovemaking? Infection in the vagina. I had IVF and lost my baby pregnancy due to chromosomal abnormalities. What next? So sad though. But if you lost your baby following IVF from chromosomal abnormality, the best way to do is to do genetic screening for the embryo before transfer in the next IVF to prevent or avoid chromosomal abnormalities in the baby that is transferred. So before the baby is transferred next time in your next pregnancy, your next IVF, let us do genetic screening in the ATG Laboratories IVF Center, which will open soon. Okay, once we open, I'll let you know here. We do genetic screening if you want for the embryo before transfer, but definitely that will come at a slightly extra cost. But if you want that for peace of mind, you have to consider doing that for your case, my sister. Signs of endometriosis is pain during sex, pain during period, pain that is so bad some few days before your period starts, and after your period starts, the pain starts to subside. Pain during sex, pain when you open your bowels, pain during your period, some few days before period, and that settles down shortly after your period starts. What causes watery discharge? Something like that. What causes fluid in the part of Douglas? You can have fluid in the part of Douglas from ovulation, from ectopic pregnancy, from PID, and from operation as well. So it depends on your story. If someone is ovulating, they can have fluid in the part of Douglas. If someone has PID, they can have fluid in the part of Douglas. If someone had ectopic pregnancy, they can have fluid in the part of Douglas. Okay, so fluid in the part of Douglas does not mean anything. It depends on your story. That will put it in context to know why you have another fluid in the part of Douglas. What causes slippery discharge through circle? It's normal. It's normal to have slippery discharge. Your vagina is supposed to have discharge. I've never seen a vagina that does not have discharge. It's normal. Your vagina is like your mouth. It has saliva all the time. Vagina will always produce discharge to cleanse itself. It's a natural thing. Can someone womb fall and cause pain? You can have uterine prolapse. Uterine prolapse is when the support holding the womb to the spine. Your womb is held together by ligaments, 4. 2 at your back to your vertebra, to your spine, and 2 in the front to your groin. If you get older, as you get older, those ligaments will get weaker, and the womb can fall in some people. We call it uterine prolapse. We can do operation to pull it back, or we can do so and put some pessaries to hold it back in. Heavy E. coli, can it cause your irregular period? No. But heavy E. coli in your vaginal swab must be treated, okay? Heavy E. coli does not cause PCOS, okay? And heavy E. coli needs antibiotics to be treated. And that antibiotics they will tell you on that your vaginal swab results, okay? Folic acid can be taken with iron capsule. It's safe. You can take your folic acid with iron capsule. Naomi Afolabi. Tosin Rodipe is evidence and painful in the breast 2 weeks before period. Normal is normal. It's normal. Afolabi, Naomi, Amawumi, you can take folic acid with iron capsule, okay? Jesse Anene, I have stuff on my skin which seems to have no cure. How do you do? You have to see a dermatologist though. You have to do cure for hypolactin. We have the bromocriptine. Okay, you can take those ones to treat hypolactin. And if you are taking treatment for hypolactin, always ensure you repeat your prolactin test every 6 weeks to ensure that your prolactin is coming down and is responding to the medication. Thank you, wonderful, beautiful ladies, for coming here today. I gotta go now to get ready for work. I need to get changed and then be on the floor. I'll see you later today or early tomorrow morning to have a catch-up time with you all. Once again, I want to say I love you all. If I've missed your question, it's not intentional. I have to quickly pick the most important ones in some cases. And if I've misspelled your name or if I've missed your name, apologies too. Sometimes as I'm talking, as I'm reading names, it's difficult to coordinate yourself. So I thank you so much for watching today. I really appreciate you. If you want to do any of your hormone profile tests, just call our laboratories, ATG Laboratories. Our lab manager in ATG, just posted the lab address. So Nike, please help us post the lab address again and the phone number of the lab. And if you want to do all your vaginal swab tests, all your hormone profile tests to know why you're not infertile, your ultrasound scan, and even if you want to book for IVF, you can book now for IVF, and Nike will tell you all the details and all the prices. And once we open, I want you to be the first, because I want you to carry your baby this year. I want your stories to change this year. The purpose of ATG is to change lives. The purpose of ATG is to cause a turning around in your life, to put a miracle, to put a smile on your face, to make you carry your own baby this year unfailingly by the grace of God. And so shall it be. Amen. Have a wonderful day. And to our wonderful friends fasting, our Muslim members fasting, I wish you happy Ramadan. God bless you. I hope to see you all soon. I love you so much. Nike, please help us post the address of the laboratory now. Thank you, wonderful ladies. Hope to see you soon. Have a wonderful day. Bye-bye.